Thank you for joining us, and we'll begin in just a few minutes. We know there's been some amazing sessions this morning, and we really want as many people to keep with us. I know it's getting to be lunchtime, so we'll start in a few minutes. Please grab something and keep listening. Well, thank you for joining us today for this session, Journey of the Heart, Getting Vital Care. My name is Paige Bingham. I'm the Director of Close the Gap at Boston Scientific, and I'm joined today by two amazing doctors that I'll let them introduce themselves. Dr. Chow, do you want to begin?
Sure, absolutely. Before I introduce myself, I would just want to say that this is an amazing thing that you guys are doing, Black Health Matters, in conjunction with Boston Scientific and Siemens Healthineers. This is very timely and very to the point. So I'll just get to me now. My name's Mei Chow. I'm one of the heart surgeons over at Montefiore in the Bronx. I've been there for probably 8, 9, almost 10 years. I was born and raised in New York. And some of my focuses at work are heart surgeries, but really my main focus is transcatheter valve interventions, which are just dealing with the heart and heart problems without open heart surgery. So there are definitely options for everything. Besides that, I'm also a mother of 2 very fast growing girls. And we just all have to keep learning in this ever-changing environment that we're in now.
Well, thank you so much, Dr. Chow. And Dr. Graver, would love to hear from you.
Thank you so much, guys. And I want to echo exactly what Dr. Chow just said. This is a phenomenal opportunity and a true honor to actually be here. This is incredibly timely, and you guys have put together a phenomenal program. So just like Dr. Chow, I have been actually at North Shore, and I'm one of those lifers at North Shore, sort of bred and born there. Did all of my training at North Shore University Hospital, internship, residency, chief resident, fellowship in cardiology, chief fellow in cardiology, and then I was hired immediately as the director of their cardiac intensive care unit. While being the director of the cardiac intensive care unit, I realized the significant discrepancy that we had regarding gender, regarding treatment and diagnosis of heart disease in women. And my interest sort of kind of swayed more towards women's heart health. And last year, in the middle of when I was running COVID units, I was actually promoted to be the director of Women's Heart Program for the Central Region for Northwell. I am also a mother of 1 girl who keeps me incredibly on my toes and actually wants to be a cardiothoracic surgeon like Dr. Chow. So that's me.
Oh, well, I'm so thankful that you are both here today. Thank you. And we had a chance to meet earlier this week and discussed a few questions at the heart of the topic. And we also want to hear today from the people that are attending this session. So I think we're going to kick off with a few questions up front, but let me encourage the audience, please keep your questions coming in, use the Q&A function. We want to hear from you and we want to make this real for the needs that you have. So why don't we start, Dr. Graver, I'm going to start with you and just ask, over the past year, it's been a blur. And both of you, I know, have experienced life in a way that you never imagined. Can you share your personal experience? We'd love to hear from you both, but Dr. Graver, you first.
Sure. So like I mentioned, I was running the cardiac intensive care unit, and last year on March 16th, I got a phone call from our leadership saying the fact that my unit will be the next unit that's going to be designated to be the COVID unit. But maybe they mentioned that maybe it'll take maybe a week or so to get there. I got a follow-up phone call at 4 o'clock in the morning. This was March 17th, the fact that my unit was now filled with COVID patients, and I'm now officially redeployed into COVID land. From May 17th till about end of June of last year, I ran COVID units. So March, April, May, and June, that's all that I did. I worked anywhere between 14 to 16-hour shifts running the COVID units. And in the beginning, obviously not knowing exactly what we're dealing with. Professionally, incredibly scary, but professionally also incredibly enlightening, just because I saw camaraderie among physicians like I've never seen before from all different specialties. My team was me, there was a rheumatologist, there was a dermatologist, there was a pulmonary critical care, anybody and everybody that could lend their hands were there. Scary. It was nothing but scary, especially in the beginning when we did not know what we were dealing with, and then subsequently not knowing what it is that we were coming home with also. Leaving my child, I'm a single mom, so leaving my child alone at home while I was running into the units was heart-wrenching, especially not knowing coming home as to whether or not there's a chance that I actually might be infecting her as well. So a lot of fear, and at the same time as you're fearful, you also are trying your best to actually put your sort of knowledge and anything that you can get forward to actually help some of the patients. In the midst of all of it, I actually ended up losing my grandfather in April, who got sick with COVID, who was in my unit and subsequently passed away because of COVID. So last year was an incredibly trying year, both professionally, personally, mentally, emotionally, physically, in any possible way. But we're here now and we're here talking about it. So we must have done something right.
Well, Dr. Graber, what a heartfelt story and a lived experience. Thank you. I'm sure that connects with many people in the audience, and thank you. Just thank you for your service and for sharing the loss of your grandfather. You know, Dr. Chow, I'm sorry to turn it to you next, but really would love to hear. I know, again, last year was not what anybody had ever planned for, prepared for. Would love to hear, you know, if you could share what the year looked like for you.
So before I start about my year, I just have to say, Dr. Graber, kudos to you and your team and your hospital and your family.
Thank you.
For everything that you've done, right, in the hospital. So for me, it was a clearly very scary time. Personally, what I did was I chose to move out of my house, right? I chose to isolate from my family because, right, we were all scared. We didn't know what was happening. We didn't know what we could carry, what we could bring home, what we could spread, because we were not going to not go to work, right? We were going to pay our part and do what we have to do. So I isolated from my family. That was hard, just to keep my family safe, right? You know, my elder parents, my 2 kids, my husband, everybody. But that's a lot of people, right? Clearly, you know, I was not the only one. Many people were looking for places to live because they wanted to help the hospital and help the patients in the hospital, but to also protect their own family. A lot of milestones that were missed, but again, here we are today, and we're all happier and grateful for everything that's been done. So in the hospital, though, I mean, I guess a blur is a really good way of putting it, right? I don't know how we all think about this past year and how we can all think that it was really the longest year, right? The most trialing year, in every level, the most trialing year that we've had, the longest year. But yet, you know, now that we're sitting here, we're thinking, how did we just miss a whole year of life? Where did that year go, right? I think, you know, as a heart surgeon in my heart surgery department, our faculty was deployed to run a brand new unit that was created from the ground, right? There was nothing there, and all of a sudden, one day, we just got a call, the department got a call and say, your team is now deployed and gonna be running this ICU, right? I tell, in retrospect, I tell people some of these stories and they're like, it's so funny that, you use the word deployed, right? Deployed was the word that we used to say, this team is getting deployed to this unit. These people are going to get deployed to this unit. It was warfare, right? It was ridiculous. But, what I think about the year was, it was incredibly heartbreaking. So many things that were so heartbreaking about it. But I think the best thing about the year that came out of it was how we saw humanity evolve, right? How we saw all the people, just like in Dr. Graber's ICU. We had people from all walks of life, every level, every kind of physician, every kind of nurse, every kind of anything come to be at the patient's bedside, right? Because at that time, our patients couldn't be, having visitors come and see them, whether they're kind of sick or super sick or ventilated, aware, not aware, they couldn't have any family, right? So the people in the hospital became their families, right? And it's so important for that. And I think that, it was just a grueling year. How did it go by so fast? But yeah, it was so painful when we were doing it. And I think that it was just amazing for us to be trying to climb out of this right now, and be on the ups of it. Right. So I think that it was an incredible year, and a blur is right.
Well, thank you, Dr. Chow and Dr. Graver as well. Such lived experience and the past heartache of the year. I think that also in this past year, we've had other challenges societally, and we've really seen, the racism that occurs in our society that's been there for centuries, and that there's awareness now that this disease and the current state that we're in from the disease perspective has really impacted, again, a group of people disproportionately due to their race and ethnicity. We're here today with Black Health Matters, recognizing that the Black community is one of those just deeply, disproportionately impacted. I know you both and I were talking about the Center for Disease Control and their comment about the serious public health threat that racism causes, and just am wondering, what is your hospital doing, institutionally and, from the personnel perspective as well, to fight against some of the disparities that really came to light in the middle of COVID and the disproportionate death rates, and that's been there for a while, and is a huge part of why we're here today to talk with Black Health Matters and the people attending this event. Dr. Chow, can I start with you?
Absolutely, absolutely. So I think that I think education is key at every level. I think racism has been, like you said, centuries in the making, right? And it's continuing. It's built into us, every single person, right? Every single person that's been growing up in this country. It's built into us. It's built into our upbringing. It's built into our lives. It's built into our implicit biases. And I think that, how could we deal with something this big without even knowing that even exists within ourselves? So at our hospital at Monty, we have a lot of opportunities to talk about things like this, and racism, implicit biases, diversity, and inclusion, because it helps all of the people in the hospital define it and deal with it as an institution. So what we do is we have a lot of educational modules, right? Educational modules at every level, to go through and to understand, to start from the beginning and to understand and see how we can personally instill change, and as an institution as well. So I also help with the training program for the heart surgery fellows, right? So I'm an associate program director, and it's important for us to always be in contact and have constant conversations that are meaningful with the people from the medical school and from our faculty, to talk about all these things, the biases, the diversity, the racism. And so we can then really participate in the conversation globally and broadly. So I think that's what my hospital is doing. And I think that, it's a constant learning process. So there's always new modules to do, when something happens, there's always a refresher, right? Because we don't know that it's in us. We have to be told that, oh, look, your definition of racism or your definition of inclusion and diversity may not be the same as mine, but why isn't it? We got to learn about it and then start and grow together as a person and as an institution.
Well, thank you so much. And I know we'll go on to asking Dr. Graver, but before we do, I understand that there's been some technical difficulties. So sorry. So maybe just a quick reintroduction of who we are. My name is Paige Bingham. I'm with Close the Gap and Boston Scientific. And just talking with us was Dr. Chow. Dr. Chow, if you want to introduce yourself again.
Yeah, absolutely. My name is Dr. Chow. I'm one of the heart surgeons at Montefiore Medical Center in the Bronx. I focus on a lot of cardiac surgery and transcatheter valve surgeries that doesn't require open heart surgery. I'm a mother of 2 girls.
Wonderful. And Dr. Graver.
My name is Dr. Graver, Evelina Graver. I life at North Shore, did all of my training there, hired as the director of the cardiac intensive care unit. I've been running my cardiac intensive care unit for the last 8 years, and last year was promoted to be the director of Women's Heart Program for the Central Region for Northwell, covering North Shore University Hospital, LIJ, Sandra Atlas Hospital, and Katz Women's Institute. I'm a mother of 1 girl who keeps me busier than anything that I ever do professionally.
Well, and if you're just joining us, you might have heard Dr. Chow in the middle of answering a question about kind of recent publication that the Center of Disease Control did, declaring racism a serious public health threat. And so we were going to switch now to Dr. Graver and just ask her, recognizing that racism has really been very present, especially as we've seen the impact of COVID on our loved ones and those communities of color based on race and ethnicity. Just what is the hospital role in this? How do you care for individuals and fight against racism, both institutionally and interpersonally?
Sure. So interestingly enough, North Shore University Hospital and Long Island Jewish Hospital are about 1.5 miles away from each other. However, patient population is incredibly different amongst the 2 institutions. And the diversity that we see at LIJ is definitely a lot more significant than we see at North Shore. However, during the time of COVID, we were all one. And it was interesting actually how the education, similarly to what Dr. Chow mentioned, how it really kind of came about at that period of time, but more importantly is awareness. Awareness and understanding the fact that African-American are at a much increased risk for early onset hypertension. Thus, they might have worsening outcome from COVID. Awareness, understanding the fact that African-American women are at much increased risk as well. So that kind of awareness that kind of came through during the time of COVID was actually truly eye-opening. Just like Dr. Chow so teaches her fellows, I teach my fellows, and I also have the honor to actually teach at the medical school, the Hofstra Medical School. And we've had multiple sort of educational lectures in regarding to cardiovascular disease and racism, how different groups actually get affected by cardiovascular disease and how subsequently they're affected during the time of COVID. And then vice versa, those patients that have had no underlying risk factors because of COVID, how their heritage, ethnicity, and everything else that subsequently led to their sequelae post-COVID. So it was a completely an eye-opening experience in regards to potentially how we were actually able to treat people in reference to potentially also understanding the awareness of to sort of a little bit being more urgent, meaning a Caucasian woman in her 20s or 30s that coming in with COVID might not have the same sequelae as an African-American or a Hispanic or actually an Asian woman that is coming in at the same age. And that kind of education and awareness was very quick and very eye-opening. And it was actually kind of interesting to see how the health system sort of immediately responded to that in reference to getting educational support, not only for the physician, for the nurses to understand how to appropriately treat some of the patients.
Dr. Graver, those are great examples. And Dr. Chow, I want to build on this because I think this is where both of your systems, both of your hospitals, the people that you're training really are deep into the community and making available other services, other resources, and recognizing the needs go beyond the exam room. I just want to make sure that there's a moment, Dr. Chow, for you to also add there, or Dr. Graver, any additional thoughts?
I think that we were, as a hospital system and as the teams of people taking care of these very sick patients, I think we adjusted very quickly and we learned really quickly about things that were coming through the door that we didn't know anything before. I mean, we all know about healthcare disparities and outcomes that are, definitely poor in certain communities of color, right? And it was just so blatant when we saw these patients come through the door and come into our COVID units. So it is very, 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 it was like enlightening, and it's nice that Dr. Graber, brings it up, because it was clearly very obvious to the caretaker teams.
Well, thank you. And I know now, as we think about people being vaccinated and we think about what the healthcare, hospital, and clinics look like, I'm curious, what's changing? What do you see that's different now, and how are you keeping people safe? Dr. Graber, do you want to start?
Absolutely. So I'm actually going to start off initially with just a personal story, potentially, that I'm sure, just like Dr. Chow, being on the front line, we were the first ones to be vaccinated. I was vaccinated literally first part right at the end of December, and my second shot of the vaccine was actually January 12th. And then in the midst of all of it, February 9th, I got sick with COVID. So I was one of those vaccine breakthroughs, as CDC has sort of mentioned, in regards to potentially still getting the virus after the vaccine. And a lot of people that actually were questioning the vaccine said, you see, what's the point of getting it? Why did you get it? Why did you put yourself through that? But I can tell people at this period of time, having gone through everything, is the fact that I have no idea what my symptoms would have been like, what my outcome would have been like if I did not get a vaccine. Knowing the fact that I got the vaccine beforehand, I know the fact that it significantly lessened my symptoms. I think the fact that it definitely kept me out of the hospital and improved my chances of not passing away, which is a good thing. I think in addition to that, also, it was interesting, the fact that I did not have very typical symptoms, as they say. And right before I found out the fact that I was sick, I actually was around other people that were also vaccinated, and I didn't get anybody sick. So there is some truth to it, the fact that when you are vaccinated, when you are around people that are vaccinated, chances of you actually transmitting is actually smaller. So I think that the way that we are approaching vaccines, and I know it's such a tough discussion, especially after the most recent setback with the J&J vaccine, I think that people that were on the fence at that period of time really said, well, you see, now that it's clear the fact that we shouldn't be getting it and everything else, but over and over, we proved the fact that it does work. It does work. It does lessen your symptoms should you get it. It does decrease the chance of actually transmitting it. The way this health system, North Shore and Northwell overall, is approaching it is they have made the vaccine open to everybody and anybody. They have made a lot of sort of support groups also in reference to potentially getting the vaccine, not only for the healthcare workers, but for their loved ones as well. So that's one of the ways that potentially we're actually able to include everybody in the process to potentially try to contain the virus as much as we possibly can at this period of time.
Well, thank you. That just is some great information about Northwell. And I'm going to return to you in a second, Dr. Chow, but I know we have a question. And again, please keep the questions coming in the chat. And so the question that came in is, a patient who has been diagnosed with a heart murmur, what advice might you have for them to lessen their COVID-19 symptoms? And I don't know, I'll let the two of you flip as to who wants to take a heart murmur and the patient wondering how to lessen COVID-19 symptoms.
I think that both Dr. Chow and I would both see a lot of people with heart murmurs. I see them as a cardiologist first, and if God forbid anything needs to be done, I then will forward it to Dr. Chow to actually treat appropriately. A heart murmur in the setting of sometimes things such as pregnancy, such as dehydration, could be a very benign thing, right? I think that the most important thing about heart murmur is understanding the fact that it's just an extra hard sound, right? It's an extra hard sound that potentially due to a flow of blood, whether or not it is in a normal way of flow in the blood, or sometimes it could be a little bit of pathologic. But before getting panicky about anything, I think that seeing a physician, seeing a cardiologist potentially, and getting appropriate workup with an echocardiogram, which is an ultrasound of the heart, is quite important. Now, in reference to potentially its effect with COVID, COVID, one of the symptoms of COVID is shortness of breath. And at times, heart murmurs based upon which valve is involved, what's actually happening, and everything else can also come with a sort of a symptom of shortness of breath. So before saying the fact that my symptoms are COVID related or my symptoms are heart murmur related, a little bit more workup will definitely need to be done. Dr. Chow, what do you think?
I absolutely agree with you. And I think that it brings us all back to the initial question that was posed by Paige. I think a heart murmur can be very benign, or it could be alerting you to something else that's more significant, right? I think the bottom line of, one, knowing that you have a heart murmur, you should maintain follow-up with it, right? Maintain a continuity of care with the physician that gave you the diagnosis. Maybe it's echoes, maybe it's you have to have a diagnosis of why you have that heart murmur. And I think that, to minimize symptoms of COVID, like Dr. Graver said, shortness of breath can be related to both of these, from COVID and COVID and a heart murmur. And I think that, honestly, to minimize the symptoms of COVID, I'm going to have to go back to the vaccine point, right? Now I'm going to take the opportunity to answer the question that Paige had initially posed about, vaccines and how I feel about them and my personal experience with them. I think that, again, like we had been saying over and over again, COVID's very scary. It has every right to be scary. It was very scary last year. It's less scary now, right? And things that we already know, healthcare disparities, right? Outcomes are more poor, significantly poor in communities of color, right? Why would we want to make that gap bigger? Why don't we want to, lessen that gap, right? So, vaccine has never said that it was 100% effective, right? What they're saying is, maybe it'll decrease your chance of getting COVID. And if you get COVID, then maybe your symptoms will be less significant, right? As people, Dr. Graver and I, as people who have taken care and managed patients with COVID and seen the whole wide range of how COVID can affect a patient, being from asymptomatic to, really passing away or, being very, very extraordinarily sick. And we don't even know all the long-term effects of it yet, right? So, when I got the vaccine, I'll tell you the second shot, I got it probably I think my second shot was mid-January, right? And I was extraordinarily sick. I was febrile, I was nauseated. These are all things that they tell you, which is okay, right? Because as I'm going through it, I'm like, well, I'm gonna get over this because this is a side effect of the vaccine. I got over it in 24 hours, right? But while I'm going through this, because I think it's, everybody's very dramatic when they go through things, right? It's very terrible. As I'm going through this, I'm thinking, well, if I got COVID, this will be longer than 24 hours. If I got COVID, then, who's to say that this would be what I'm feeling? I could have ended up in the hospital. I could be intubated. I could be on not having family at bedside, having to say goodbye to this world, right? And to know that I got the vaccine, and even if I get COVID, then my symptoms will be hopefully minimal, right? And that would also end, right? So that's how we minimize COVID symptoms. And that's how I would drive this question right back to getting the vaccine and how I'm a supporter clearly of the vaccine.
Well, thank you so much. And I really appreciate that clarity of experience, because I've heard many people have a similar reaction, especially second vaccine. And it's good to hear healthcare professionals share your own experience and how to put it into context with the medical knowledge you have. There's also been a great question here. After having COVID-19, what should one be conscious of regarding increased blood pressure and increased blood pressure rate?
So I'll take that one because I deal with blood pressures a lot. So I've seen COVID do both things. I've seen COVID actually exacerbate patients into actually developing higher blood pressures. And I've seen COVID actually drop patients' blood pressures. I think that just, and again, there's going to be so much research coming out of this within probably the next year or two or 10, obviously. But the inflammatory component of COVID, right? We know the fact that COVID is a highly inflamed state in our body, potentially can exacerbate certain underlying diseases. African American people are at more risk for developing early onset hypertension. So the way that I extrapolate some of the data is that COVID, that's actually in an inflammatory state, can actually exacerbate that to actually cause people to develop high blood pressure earlier on. So what does that mean? It means the fact that, number one, you monitor your blood pressure. You monitor your blood pressure, and if it's persistent, based upon your underlying risk factors, if it's persistently high post-COVID, definitely seek medical attention to potentially need to be started on therapy earlier. Obviously, also understanding the fact that 80% of cardiovascular disease is preventable. Okay, hypertension definitely falls into that, and a lot of it goes into sort of lifestyle management. I think last year has made a lot of people very sedentary and incredibly attached to their refrigerators. So I think it's time to disattach right, and genuinely a lot of people have a lot of emotional eating components, and listen, when it's scary, we all want to cuddle up and eat sweet and salty stuff. Sweet and salty stuff will exacerbate your blood pressure. So at this period of time, now that it's getting nicer and warmer out, I think this is the time that it is safe to go out and to actually do a lot of lifestyle management issues to try to control some of those blood pressure issues.
Wonderful advice, especially on a day that I think it's hot and humid in New York. So the weather's getting better and taking advantage of it. I know there was another question. Can you have high troponin levels and not have an issue with your heart? So glad we have people that are really cognizant of heart disease and how to help manage their signs and symptoms. Dr. Chow, do you want to jump into that one?
Absolutely. I think that can we have high troponins without having issues with the heart? I think it's a sign that the heart is a little stressed, and the way that COVID can make the body respond, it could indicate that your body is stressed. I also think that, there's some troponins are metabolized, through the body, and if there's systems in the body that is not 100%, your troponins will appear elevated. I'm going to take this opportunity to talk about how, yes, it's important to know about what your body is, but it's also important to follow and trend it, right? And that's how I would bring this all back to, creating a conversation and a relationship with physicians and bringing that into a long-term relationship. I think that, yes, I think a one-time value of high troponins is an issue, right? But we also have to investigate on, has it always been high? Does it always stay high? Are you metabolizing it? What other problems are there going on in the body that could elevate your troponins? So I think that, that's important, but it's also important to know why, how, and where it's going to go.
Well, thank you. I really appreciate the range of questions that have been here. And I know we're at wrap-up time, so I just would like to ask that final question is, how could somebody get to see one of you? You've both been amazing panelists. How could a patient or an individual listening get in touch with your institution and your practice?
So from my standpoint, it's incredibly easy, right? There's actually a couple of things. You literally just call my office. I can definitely leave the number in the chat if need be. It's easy to get in touch with me in reference to just getting in touch with my office. That's it.
Thank you, Dr. Chow.
So I think that the Summit team has done a great job at the virtual, booths. I think Montefiore has a great booth there. There's contact for people to just call to get in touch with a physician, because now telemedicine is very easy to access. There's also we have posted a lot of things from our community outreach department, and there are just links and links of opportunities for people to look at and to really take advantage of, and not feel alone. The number's there. Just visit the booth and see what there is to do.
Well, thank you both. This has been an amazing session. You truly did provide vital care and care of the heart. So thank you for your caring hearts and time with us today. Appreciate it so much. Goodbye.
Thank you.